Okay. All right, we'll move on to the second part of this conversation, connected but distinct. Oh. And we'll invite Mathia and her team to share, and there is one. Oh, hold on, we've got to do the draw
just
first.
1 second.
I totally forgot about the draw, which never happens to me. It's my favorite part.
Yay. First, I'm going to Vanna White the book. So have to give a big shout out to Katie Johnson, Bella Elite Consulting, and Linda Johnson for creating what is an amazing collector's item book for Kluwani First Nation. It's basically our history. So some lucky person gets to see and learn about the Kluwani First Nation history. So we got your tickets. Oh my God, am I supposed to read that? 938. 938.
We'll hold that ticket with the book because there are folks that aren't in the room. Oh, yay! Perfect!
Woohoo!
Yay! Can I do that?
Woohoo! Woo! Yeah, we
Do
should
want
get you to
dance,
dance.
but I don't have any music, Jesse.
Yeah.
Woohoo! You need to come. Yay! There! Oh, Claire's got it.
Oh, Riley's right there. That's perfect. Thank you. So one of the other projects that we're involved in is the ATV project. So ATV is Yukoners Attitudes Towards Vaccines. One of the big things, I'm going to invite the team up. Come on. This is Ruth Nelson, who's our lead. Project coordinator, researcher. She's the one that pulls all our meetings together, and I was supposed to be the chair, and I'm like, oh, Ruth, you do a much better job than me. So Ruth is going to be doing the presentation along with me and Carrie.
Dr. Smart is going to do a guest appearance.
Yeah. So Carrie is she joining us? Yeah. She's online? Yay. Okay. We'll just get Carrie to turn her camera on, and then Dr. Smart is going to join for a section of the presentation. So the ATV project is a research project that we're undertaking. It's the second research project that we've been involved in. And Ruth, I'm going to hand the mic to you, and you can just introduce yourself, where you're from. It's hot because my hands are hot.
Thank you, Mathia. Hi, my name is Ruth Nielsen. I was born and raised here on the traditional territories of the Tahnquichan Council and Kwanlin First Nations. My parents are Betty and Per Nielsen. I'm so grateful and honored to be able to return back to my home now to be a part of this project. So I joined the project in July of this year as a sort of project coordinator, researcher role, and it really is just a privilege and honor to be a part of it. My background is in education and equity, qualitative research, and really looking at how we can decolonize research practices, decolonize research methodologies. And so I'm honored to be a part of a project where we are putting that into action. We're realizing that.
Yay. Danche, Carrie, do you want to introduce yourself? Okay.
Good morning, everybody. My name is Carrie Uye Johnston Iche, Dakokara Huninje. My name is Carrie Johnston. I'm a settler living on traditional territory of Champlain and Ajax First Nations, and I'm really pleased to be here this morning. Thank you.
Yay. So we're going to get started. I don't have the notes.
Do you want me to bring my computer up here?
Yes. So I'm just going to go overview of the partnerships that have been established to make this project a reality. So one of the outcomes of the pandemic was seeing the effect of I don't know if it was social media. There was a lot of shifting attitudes towards vaccines. At the beginning, it was like, yay, we get vaccines. This is going to help save lives. And then towards I guess, a year into it, there was a lot of, the attitudes had shifted. So the project is really about finding out, I stand up here so you can see me, finding out about how those attitudes shifted and why. What were the factors that affected the shift in attitudes towards vaccines, and we wanted to do it in a way that was inclusive of First Nation communities. So our partners are Council of Yukon First Nations, One Yukon Coalition, Yukon University, and Champagne-Ushak First Nation and Selkirk First Nation. We do have one other First Nation that we're working with, but we haven't gotten sign-off for them to participate. So this is our team. We're funded by CAHR. We are funded through NSERC as well. And there's a lot of in-kind contribution. So Alexis Anderson at CYFN is on the team, Allison Perrin, Yukon University, Dr. Amanda Boyd, Washington State University, Amy McKinnon, Champagne-Ushak First Nation, and we also have, who's the new communications person at Champagne-Ushak? Jenna Henderson. Yeah, Jenna Henderson is on the team as well. Dr. Eric Merkley, University of Toronto, Dr. Lyra Smith, Yukon University, James Pugsley, Communications Specialist, Jenna Henderson, Champagne-Ushak First Nations, Carrie Johnston, One Yukon Coalition, Catherine DeRocher with the Daly-Dena Council, Dr. Catherine Smart, medical doctor, Christine McTavish, Council of Yukon First Nations, myself, Medea Latini, One Yukon Coalition, Dr. Michelle Leach, Yukon University, Dr. Rhiannon Klein, independent researcher, formerly at Yukon University and now living in Edinburgh. Ruth Nielsen, ATV project coordinator. Selkirk First Nation is another project partner, and we don't have champions identified for Selkirk. So if there's anyone from Selkirk that wants to step up, we'd love it. Tracy Nolan, Liard First Nation, Tristan Newsom, Selkirk First Nation, Tyler Porter, Daly-Dena Council, Vanessa Norris, Daly-Dena Council. So I talked a little bit about where this project had come from, and one of the big pieces is we need to be able to be prepared for the next pandemic. How is this information that we're collecting going to be inform the next pandemic? Because really it's around the attitudes towards vaccines or medical intervention that we have to figure out how does that get disseminated to our communities so that people can hear it and we'll be able to answer questions in a way that is barrier-free and communicate in a way that is of service to the community. And through our teams, the COVID Communications Working Group, we saw that during the pandemic, that really taking that community position or community view to communications is extremely important if we want messages to be heard. So creating our team, we had some involvement with Eric Merkley because he has a background in researching epidemiology or people's attitudes towards medical interventions. And we turned to him quite a few times during the pandemic just for expert advice and just around data. What kind of data are you finding? Where are you finding it from? How can we access that? So he became a real resource for us, and it was incredible when he said that he would participate in this project with us and be a guiding force. So just going back to this team here, Dr. Amanda Boyd was also had done work, and she's in Washington, but she's done work with First Nation communities throughout Canada and US. And we really wanted to take that expertise that she has around community engagement and be able to translate that into our project. So we brought a real, and that connection came through Christine in her previous work with Nunavut and different groups in the East Coast. So that was like how we created our team, and really wanted to be able to address this. And we put in the submission, we got the money, now it's the important part of doing the work. So what are we doing next?
I was going to go into a little bit more detail about where the project came from and your experience on the Yukon First Nations COVID response team.
Okay.
And I think Carrie was going to talk a little bit about those spikes in COVID cases that we saw that really prompted the need for communicating the need for vaccines.
Mm-hmm. So Carrie, did you want to take these slides?
Okay, thank you. So Yukon First Nations COVID response and our observation of the pandemic through work with leadership and with the communications working group broke the pandemic down into different stages. And so when the pandemic first came in the first 4 months, there was a lot of crazy, it was, a lot of fear and building new structures to help us respond to the pandemic. And so we call that the, crap, we're in a pandemic phase. And then the next phase was our first reopening, and that was really our first summer living with COVID-19. Yukon had closed borders, a lot of restrictions upon returning to the Yukon, and so we characterize that phase as sort of our first reopening as we emerge from the initial sort of chaos. And then we welcome in the new normal, and that's our first time going back to schools as schools reopen here in the territory. And we have our first Thanksgiving and Christmas with the COVID pandemic being sort of a dominating force. And then, of course, great relief came for many of us as the vaccines arrived here in the territory early on. First Nation communities were deeply engaged in the work of getting community out to the vaccine clinics and supporting community to get there and information. And then unfortunately, as the summer came, we experienced our first real wave of COVID-19 here in the territory as the restrictions were lifted and we saw the impact of the pandemic in full force. And because of that first real wave and the impact it had within communities, leadership requested that we find new ways of bringing testing to the people to build better data sets and to find new ways of supporting community through the pandemic. And that's what we call our rapid testing and vaccine phase, or vaccine mandates phase. And that's where things really got politicized. And I think we all felt that as we saw things like the convoy and other things come into community. The Omicron phase was when we saw the end of PCR testing and centralized testing through Yukon government, and the testing was really restricted to only the most vulnerable. And then as the season grew on and we welcomed spring and summer, we call that our living with COVID phase, which is really what we're in now, as COVID is just a part of who we are and how we operate in the world. But I wanted to really highlight what happened during the, sorry, I thought the next slide was the one on stats of what happened during the first real wave. There we go, perfect. Okay, so during the first real wave of COVID-19, we really wanted to reflect how impactful that was on the First Nation community here in the territory, the Indigenous population, with 56% of the cases, 63% of the hospitalizations, 56% of the medevacs, and 50% of the deaths. When we note that only 22% of the territory's population identifies as Indigenous, it's clear that this really disproportionately affected the community. And these numbers aren't perfect. There's a lot of qualification around this because this data isn't collected really well within the Yukon medical system, but this was the data that we were able to get at that time. And then just flipping back to that previous slide around vaccination rates, it was in May 2021, right before the first real wave of the pandemic hit, that we saw the first release of data about how communities were doing when it came to vaccination rates. And we could see a real difference in communities, with some communities with lower vaccination rates, you know, in and around 26% or below 50%. And then some communities that achieved fairly high rates, like Haines Junction and Champagne-Ajac First Nations. And then, of course, all of that relative to what we saw for the total Yukon community at around, the total Whitehorse population at around 61%. So we saw great variation across the territory after the initial rollout of vaccines. So just a little bit more around the Yukon First Nations COVID response working group. It met weekly. It was made up of people who are working for Yukon First Nations governments, and where a big part of their responsibility might have been part of the COVID response or emergency response planning. Sometimes that was staff working in communications, other times community wellness, other times occupational health and safety. Each government sort of rooted its response in a different place of the government, but we met collectively and supported each other in that work, information sharing, idea sharing, engagement with Yukon government officials on data, on communications approach, all sorts of different things. It was really a wonderful time for us to come together and work collaboratively to support a project like vaccine rollout as well. You can learn more about the report by clicking on the QR code or visiting our website at oneyukon.ca. And just a big thank you to the team who helped bring that report together, as well, the interjurisdictional dynamics amongst Yukon First Nations and non-Indigenous governments during the COVID-19 pandemic. And we're really proud to have published the report. Thank you.
Yay. Great, thank you, Carrie. And then we just wanted to invite Dr. Catherine Smart to share a few words. So Dr. Smart is the past president of the Canadian Medical Association. She's a current Yukon pediatrician and advocate, and we're honored to say that she's a member of our steering committee on this project. So we'd like to hear a few words from Dr. Smart on her observations during the pandemic and being a part of this project. Dr. Smart?
Thank you, Ruth. Can you hear me okay?
Yep, we can hear you.
Okay, great. Thanks for the introduction, and thanks for including me this morning. I'm really excited about the work of this group and this project going forward. I had the opportunity to serve as president of the Canadian Medical Association during the second year of the pandemic, and really saw the impact of the pandemic across the country and a lot of the learnings that we had in the health system around the pandemic. And it really, I think, highlighted a lot of things that we already knew, but on a different scale. And I think what Carrie was just talking about, you know, was very similar. What we know is groups of folks that were already marginalized in our healthcare system were, in an unsurprising way, disproportionately impacted by the pandemic. And there was much higher rates of death and poor outcomes for those groups. And I think that's what we've seen in the Yukon. And I think it's really important that we seek to understand what happens to people in the health system and why certain people have different outcomes. And I think what we know is we have a long history of systemic racism, anti-Indigenous racism in our health system, and those things impact relationships and trust. And that means it's going to impact people's willingness to accept certain medical treatments, interventions, and suggestions because of the experiences that they've had in the health system and with healthcare professionals in the past. And in the present as well. And I think this work here on understanding Yukoners' attitudes towards vaccination, how people feel, what their experiences are really important in terms of informing how we move forward around vaccines and immunizations, future pandemics. But also, I think it helps us really understand more broadly what people's experiences are in the healthcare system and how we can better serve groups of people that have been traditionally marginalized and making sure that their voices are heard. So that's something that I feel very passionate about. I think the other piece that's important to understand is the pandemic also really put the misinformation movement on fire. And it's really created, I think, across the population, a lot of uncertainty around certain things. And immunizations, unfortunately, are one of them. So even though we know the science of vaccination is very strong, and it's honestly probably the medical intervention that has the most data in terms of safety and efficacy of really anything we do, It's also, unfortunately, an area where there is a lot of misinformation and a lot of concern. And we need to be able to hear those concerns. We need to be able to understand what people are thinking and feeling, what their experiences have been, so that we can help answer those questions in a way that builds confidence in our system. And I think this work of going in, hearing from communities, listening to people is going to be really important, so that we as professionals and providers can make sure that we're actually answering people's questions in a way that's meaningful for them. So I think this work is hugely important. It's been incredible leadership, and I feel very fortunate to be a partner in this space moving forward. So thanks for having me today, and thank you to everyone else on the team.
Thank you so much, Dr. Smart. I'm going to pass this back to Carrie now to share a few statistics about the most recent vaccinations that we have from this year, really from the last month. Carrie?
Thank you. Yeah, so we work closely with Yukon government to understand sort of where vaccination rates are in the territory now. And you can see that the territory really did an exceptional job when it came to the first 2 doses of the vaccine, which are highlighted in those blue and red bars, and as well as, and most importantly, in our older demographics where we see a lot of vulnerability to COVID-19. But we really haven't seen that same level of uptake in the recent bivalent and then the XBB vaccine that's started to be administered this fall in the green and the purple bars. And that, we're not seeing particularly high uptake even in those more vulnerable age groups, the 50 plus. And so, what's going on there? How do we support higher uptake of vaccines now and into the future? What happened and what's the shift? We can see similar trends sort of across vaccine or when we look at vaccines across the territory and by community. It's always amazing to live, work, and play on the traditional territory of Champagne-Uinaijaaq First Nations, and how the community comes together to support each other. That higher rate there with the 41 for the 70 plus, I believe anecdotally that that's the result of the community coming together and holding vaccine clinics where they bring the elders and seniors together in the community, have the vaccine, and they also have a community meal and dinner and socializing time. So I think we do see that in communities where we think about vaccination as a community response, as well as Old Crow, that those things are coming together. And so we're really excited to dig into this and in this vaccine hesitancy project, or attitudes towards vaccines, to learn more and bring this out of anecdotal and into a report and into something that we can observe and learn from.
I just want to highlight something out of that summary. I think it's extremely important. We saw it throughout the pandemic. It's how our vaccines are delivered is a big deciding factor in how it gets uptake. I think that piece around Champagne-Uinaijaaq's success with the 41% of 70 plus getting vaccinated right now is incredible. Like, far outweighs other communities, well, Old Crows in competition, but it's really about bringing that sense of community, and so determining how things get done is really a big piece of this.
Great, thank you.
And then just looking at influenza response, of course, when we're looking, in vaccination, when you're looking at the 23-24 data, that's very new data, that's this year, and so take that in consideration. But we have vaccination rate around 29% for the last couple of years. We had that greater increase during that first year of the pandemic, when we were really encouraging people to come out and get vaccinated at 36%. Unfortunately, we don't have access to data that goes before 2019, and that was a real challenge for us even when the pandemic came, because the message was we're going to roll out the COVID vaccine similar to how we're going to roll out influenza. And it was like, great, what's the data? What does my community's data look like when it comes to vaccination rates? And that data just wasn't available for us. And so I think it's about ensuring that data becomes community level data, that vaccines work when we do them as a community. And I think it's sometimes about how we shift our attitude just generally in the territory away from or into a collective response when it comes to keeping our whole community safe and healthy.
Absolutely. Thank you, Carrie. Just looking at the time, I'm going to just move ahead a little bit to look at what our team actually looks like now and what the project is getting into. So knowing that vaccination rates are decreasing, but that communities have done incredible work in communicating the need for vaccines and communicating with their citizens, we really wanted to learn, how do Yukoners make decisions about vaccines? Where do they get their information, and who do they trust? And at its foundation, we want this project to be community-led. The project is community-led, and it's grounded in the principles of OCAP. So we want to learn more about the attitudes and beliefs of First Nations communities around issues of communication, trust, history, and other factors that influence decision-making, and specifically decision-making around COVID-19 and flu vaccines. So our team came together through the Yukon First Nations COVID response team, started with One Yukon Coalition, who joined with Council of Yukon First Nations to ensure that the voices of Yukon First Nations would lead the project. From there, our team partnered with communities who wanted to engage in this project. So we have partnering First Nations communities who are a part of the project now, and more who are joining. And then we collaborated with other active researchers in the territory who are working on COVID-19 research. So today, this is what our team looks like. It's led by a project steering committee who is community representatives from our First Nations communities, who is made up of champions in communities, medical experts like Dr. Smart, and research experts like Dr. Boyd and Dr. Merkley. From there, we have our core collaborators. So that's where we have One Yukon Coalition, Council of Yukon First Nations, and Yukon University. And then we have this incredible research team that will be undertaking the research. We are still open to hearing more if other communities want to be involved, or if people want to be a part of our steering committee. And so if you would like to be a part of the project, or if you have questions or comments about the project that we're not able to answer today, you can reach out to me. You can give me a call, you can text me, you can email me. I'm here for the rest of the day. You can just grab me, and I'd love to start that conversation.
Mm-hmm. And I think it's really important to state that the two methodologies that we're doing a kind of community-based case studies, and then that will help inform the territory-wide survey. And that will also be held in conjunction with the regional health surveys. So the regional health surveys are conducted by CYFN's research team, and that will help inform the territory-wide survey as well. So if you want to participate in the survey, or you would like to participate in the community-based case studies, that is with the partner communities, we're totally open to that. And Ruth would love to hear from you.
Absolutely.
And I think that's it.
I think we're at time. Maybe if there's any questions.
Some time for some questions for sure.
Okay.
Questions on ATVs, again, not four-wheelers, but attitudes towards vaccinations. Oh, Jesse's got one online.
Can I go back?
Yes, I can. Thank you, Carrie, et al. Ooh, fancy one. Super informative. Other than Pelly Crossing, it seems like it's the 3 Yukon First Nations who don't have a settled land claim that have the lowest vaccine uptake. Can you or someone from your team speak to that?
I can.
Oh, go ahead, Medea. Do you want to?
Yeah, maybe I'll speak to the Ross River experience. And I think this is one of the impetus for this project as well. Just as the vaccines were coming out, Ross River was part of our communications working group. James was on the committee or the working group for Ross River. And Ross River had already experienced, at that time, 2 deaths, and it was young people from COVID, fairly young. One was like, I think, 40s, and the other person was 50 plus. And so there was already a major impact on the community with COVID, but there was an elder who had a dream about the vaccines killing people. And he started talking about the dream, and that just shut people down. They did not want to have any conversation around vaccines, did not want to take vaccines, but there was also the dialogue about people are dying because of COVID, and there's a vaccine that could prevent those deaths. So it took another death in the community before we saw an actual uptick in vaccine uptake. So it's things like traditional beliefs that affect how people approach vaccines. And how do you communicate to a community and talk about the effectiveness or the efficacy of a vaccine if an elder has had a dream about a vaccine? And it took the elder talking about, well, maybe these vaccines are safe. And by having that conversation with the community, it actually gave the community the okay to go get vaccinated. So it's those types of things that we have to be really cognizant of when we're talking about attitudes towards vaccination. Because it's not all, the convoy or some crazy conspiracy theory that you're getting injected with tracking devices. It is some very real on-the-ground, traditional knowledge, practical, pragmatic situations that we have to actually deal with. So I think there's that.
Great. Carrie, did you have something to add to that, or are you guys good with that? You good? Okay. One more. Oh, okay, you're going to make me run. Hold on. We have time for these 2 questions, and then we'll wrap it up, because I see you guys lining up for lunch. I'm so excited. Okay, where were the hands? Ooh.
Lunch is here.
She's first. Sorry, you go next.
Thank you for your presentation. I found it really interesting to hear more about this project. One of the things that really stood out is how collaborative you are with First Nations and really respecting OCAP. And I was wondering if maybe you could go in a bit more detail about the process that you followed to kind of implement that practice.
Yeah. Mithia, did you want to start?
I can, or Carrie. If I miss anything, Carrie, just jump in, please. So we really wanted it to be First Nation driven. And I think from some of those experience of, we're not just dealing, we are dealing with situations that are very unique to Indigenous communities. Like, how do we incorporate traditional knowledge about, and a principles-based approach to our communication? And how do we affect what could be the behaviors of community? And I think some of the communication campaigns that Champagne Asia did really made a big difference in uptake. So we know that it takes community and community communications to really change behaviors. So how can we take that lesson and really take that lesson from the community level and integrate that in? And that was really the impetus for having a First Nation-led, the community-based practical approach, I guess. I don't know if that answered it. Go ahead.
So some of the data that I've been looking for and not been able to find anywhere is the relationship between lower vaccine uptake and permanent staff in the schools and the health centers. And then the second thing was lower vaccine uptake and prior experience in residential school, because not all residential school, each school, from what I've heard working in the communities, has a very unique experience. Mm-hmm. So how did that affect? And I cannot actually find data on that.
Yeah, I don't think you're going to be able to find that information, because right now the data that is being collected doesn't identify individuals as First Nation. So none of the information has that identifiable marker, so you can't differentiate, which is a challenge when you're a First Nation government trying to find out, has our population been vaccinated? If you've got, like in Haines Junction, where there's a mixed population between the First Nation citizens and the municipality citizens, and where's the uptake? And so there's no differentiation right now unless people self-identify, and that it's not necessarily an item on every form. Yay. But we'll have good data and we'll share it after. How about that?
Yeah, I was going to
Okay.
say it's a great segue into one of the outcomes of this project we've heard time and again throughout the last day and a half is the need for accessible community level data. And that's one of the outcomes of the project. Our community-based case studies will have data that's accessible and owned and controlled by the First Nations who are participating. And then our territory-wide survey will generate an open access data set that will be available for Yukoners, but it'll also add Yukon representation to the national data landscape. So we're hoping to help fill that gap in current accessible timely data on vaccination.
And